My name is Dr. Marshall Dickholtz Sr., and I've been researching the stress at the brainstem for 54 years. I'm famous for a high blood pressure research program where we lowered blood pressure 17 points, mainly with one adjustment. It was printed in the Journal of Human Hypertension and the Journal of Clinical Hypertension. About 85% of those patients only got one adjustment in 2 months, and when their blood pressure dropped down 17 points, it was equivalent to 2 drugs. So that's one of the research projects. Basically, you have to understand that the brainstem, or the brain, controls everything in your body, and the brainstem is like the fuse box of the body. It covers many ailments of different patients can suffer many ailments. But now we're researching the ability of the brain to improve the immune system. So what we're offering you today is 4 cases that we are trying to correlate the immune system, improvement of the immune system, with taking stress out the base of the brain.
It was stage 1 cancer, which they caught it in the first stage before it got a chance to spread. It was only in 1 lymph node in my left breast. It was type 3 cancer, which is the most aggressive type.
All right. And well, we adjusted you about 5 weeks ago. So we've made a notation today as far as your symptoms. But tell me, what is your improvement since you've been here?
Well, I haven't had any problem with any of my other illnesses or ailments.
And what were the other illnesses?
I have diabetes type 2. I have high blood pressure. I have congestive heart failure. I've had atrial fibrillation.
All right, let's talk about the fibrillations have stopped since you've been here?
Yes, I haven't gone in any.
And you had swollen ankles?
Yes.
And they've gone down to size?
Yes.
And you say also your breathing had been improved?
Yeah, my breathing was very short when I move, and it's gotten better.
And it's only been a few weeks, but tell me about your vitality.
Well, I feel like I'm on energy vitamins or something. I feel great.
As if your body, although your body saps energy for internal repair, the repair is a little left over to make you feel good.
Yeah.
And that is quite an accomplishment. Now you're getting radiation therapy 5 days a week. You just started that?
Yes.
And so far you haven't robbed you of any of your vitality?
It makes me a little sleepy when I first have it, but seems like once I get out of there and get out in the air, I'm revved up again. And I was diagnosed with anemia, so for all of that, I'm doing good. Okay. I don't feel tired.
You're looking great, and you sound great, and you certainly see an improvement in many aspects of your body.
Yeah, but you hit it on the nail when you said that 50 years.
Yeah, oh, that's right. I told you you had 50 years of damage in your spine.
Yeah.
And you remember an accident about that time?
When I was 7 years old, that's right.
I hit it right in the button.
You sure did. My whole family, I just gave them the card yesterday. They all want to come down here.
Well, what you want to say?
I just look forward to my next visit to see how much more weight I've lost.
Yeah, well, let's talk about your weight. So you lost 5 1/3 pounds in 5 weeks' time.
That's great.
Some of that might have been water retention.
Okay.
But on the other hand, if you're watching your diet a little bit, we'll give you credit for also cutting down some of the sweets.
Okay.
We thank you.
Thank you.
Well, about a year ago, I was diagnosed with prostate cancer, and I took several months to look around to see what the options were. I knew, because I had been a very healthy person, that I wasn't going to select or choose the traditional Western medicine form of taking care of the cancer. That is radical surgery, chemotherapy, and radiation. I wasn't going to do that. So I was looking around trying to find a resource for taking care of cancer treatment. I found several physicians around the country who does offer normal, natural health care for this prostate cancer. But I have to say that I haven't found anyone that offers the sort of simple, natural treatment that the cervical adjustment that you offer here in Chicago.
Well, you've been here now 6 weeks, and you had an atlas subluxation, and your spine was twisted, and in the x-rays it looked like there was about 60 years of damage there. But tell me how you've been feeling since I adjusted you, and also that fact that you gained a couple of pounds.
Yeah, my body weight really, when I'm at my body weight, it's about 180, and it's been down to 170, 168 at one point. But today it's 174, I think it was.
At 174.7.
Uh-huh.
So you gained a few pounds
And
since you've been here.
Gained a few pounds, and I feel absolutely phenomenal. I feel fantastic.
I got colon cancer was diagnosed. I had a bypass. I still have the tumor, and it was too big to take out. I'm going to be doing chemo.
All right. Well, we'll find out. And in the meantime, we've just discussed your case today, and I'd like you to confirm what you said. First thing you came in, you said you have no problems. Is that right?
No problems, no pains. I feel good.
All right. And since you've been here, remember, it's only 8, 9 weeks, and we don't generally count the first 4 weeks. And we gave you an atlas subluxation complex syndrome, a correction. Your atlas was off to the right 4 degrees, and we came down to a half a degree. Other than that, and you, as you say, you have more energy?
More energy. I feel great. Appetite's good.
And you've also mentioned you're feeling younger.
Yeah, I got no aches and pains.
No aches and pains.
My shoulder used to hurt. It don't hurt no more.
And how long do you have pain in your shoulder?
Over a year.
Isn't that fantastic?
Yeah.
And your color in your face is pink before it wasn't pink at all. So, and your friends tell you you're looking better?
Oh yeah, they all say I look better.
When I was in my early 30s, I ended up going to a skin doctor because I had what he called the smallest cancer he ever saw in his life. But he knew it was skin cancer as soon as he cut into it. So he exercised an area the size of a dime, and the skin cancer was probably, if it was even a quarter of the end of a pencil eraser, it was very, very small. And within 3 weeks, the entire perimeter of that was cancerous. The whole dime size. That was, yes, it was over 30 years ago.
So you've been finding 2 types of cancer, if I remember right.
Yes. In '95, I got my first melanoma. And it was on my labia, which of course did not come from the sun exposure.
And you also have basal cell carcinoma?
I have basal cell. I've had basal cell since I was 33, and then the melanoma started in '95. And I've had 5 melanomas.
And you've been running down to Mexico?
I've been going to the biomedical center in Tijuana, Mexico.
For how many years?
The first year I went down there was 1979. So it's over 30 years. Well, the point I want to make is it wasn't one thing that was wrong. There were so many things that were out of balance. And that I relate to the first time I came to you. Because when I first came to you, I was on the Hoxytonic and I was on an enzyme that they had me take, which I quit a few days before I came because I felt it was compromising your tests. And I was having indigestion, I had heartburn, I was getting to where I was getting gallbladder attacks. And I had a lot of back pain between my shoulder blades and right across the PSI joints, low back. I was tired, and I had a lot of swelling. After you adjusted me, within just a few days, there just were absolutely no symptoms of indigestion, any of that. I never had a gallbladder attack after you adjusted me. And I never had heartburn after you adjusted me. I had a little bit of indigestion for a couple of days, and that was it. Now, those were all being affected by my spine. It affects your nerves, and things don't work right. It was almost a month before my low back went in. And when it did, I got this terrible headache late in the afternoon. And the next morning I got up and that low back pain was gone. And when I would complain to you during the first 28 days, you said, I don't care what happens the first 28 days, everything's just coming back into alignment. So it's like, geez, I can't even whine, you know. And sure enough, it all came into balance.
Well, your atlas only off the thickness of 3 fingernails. And you're still holding your first adjustment?
Yes.
And when you're lying down, your left leg was short a whole inch because you had more muscle spasms on the side of the body. Now, we got blood tests on you, and your blood tests are perfectly normal now, your immune system. And we're going to have an oncologist probably look at them and give a report on this. But in the meantime, as you come in today, remember it's only about 9 weeks, You're telling me no heartburn, no indigestion, no gallbladder attacks, no swelling in the extremities, and no cervical, or dorsal, and lumbar pains, and you lost a couple of pounds of weight.
I know.
You look like $1 million, and it looks like if you can't look like $1 million and not feel like $1 million.
That's only fair.
So would you think that you're getting younger?
Well, you know what? That's what it feels like. And honestly, I ran into some people that hadn't seen me for over a year, and that's exactly what they said. Oh my God, you look so much younger. What are you doing?